Hello, everyone. This is Carla with Needy Meds. Thank you so much for taking time out of your day to join us for today's special topic webinar, which we do plan on getting started on time in just a little bit. I'm so pleased to see some people have already logged in early to join us, which is super helpful because we're going to go ahead and ask you to please help us out, if you wouldn't mind, with an audio visual check. So, if you can hear me clearly and see my screen, which is the first slide of a PowerPoint presentation, I would very much appreciate it if you would help me out by sending me a message to let me know. And you can do so by typing it in either to the questions section or the chat section of that GoToWebinar control panel. Thanks so much for your help. We're also going to take the opportunity to do an audio visual check with our guest panelist, Audrey, my friend and colleague from the HealthWell Foundation. So first of all, Audrey, if you have logged in, please give us a shout out as well and say hello. So thanks so much for those of you that are participating in this audio visual check. I really appreciate it. For those of you that have logged in, welcome to today's Needy Meds special topic webinar, which, as I said, we do plan on getting started on time shortly. In the meantime, a big thank you to those of you that logged in early and helped me out with an audio visual check. I am pleased to learn that you can hear me clearly and see my screen, which again is the first slide of a PowerPoint presentation. For those of you that have just logged in, as I said, help me out please with that audio visual check. So shoot me a message, if you wouldn't mind, in that question section, or for some of you, it may be the chat section of that GoToWebinar control panel on your desktop, just to let me know that you can hear me clearly and that you can also see my screen, which is the first slide of a PowerPoint presentation. We're going to wait also for our guest, Audrey, to give us a shout out when she joins us. In the meantime, I'm going to go ahead and practice transferring my screen to our panelist to make sure that she can grab that as well. So thanks everybody for tolerating this audio visual check. Beautiful. So we did that seamlessly. I'm quite proud of ourselves. So I'm going to go ahead and grab the screen back. Thanks everybody. And everybody should now be looking at my first slide, my first slide on my PowerPoint slide deck, which again welcomes you to today's Needy Meds special topic webinar, which is Easily Apply for copays or premiums financial assistance, presented by Needy Meds partner, the HealthWell Foundation. We're really excited to share with you information about the HealthWell Foundation and why it can help you, your loved ones, your patients, or clients get the copay or premium financial assistance you need. And again, thanks to everybody for helping me out with the audio visual check and letting us know by sending me a message in that questions and the chat section that you can hear me clearly and again see my screen, and that you were also able to see our panelist screen as well when we transferred control. We'll also ask my friend and colleague and today's panelist, Audrey, to give us a shout out as well to make sure we can hear her. So when you're ready, Audrey, just say hello to everybody, and thanks everybody for your patience and participation.
Hi, everyone.
Perfection. So heads up, everybody, that while we await to kick the presentation off on time, you will only hear silence because Audrey and myself will have our phones on mute. Don't worry, you haven't lost us. We're just waiting for the time to kick it off, and I will check back in with you. Thanks so much, everybody, and I'm thrilled to see, but not surprised, such a fantastic turnout. Thanks, everybody. Stay tuned. Hello and welcome, everyone. Thanks so much for taking time out of your day to join us for today's presentation. Easily apply for copays or premiums financial assistance, presented by NeedyMed's partner, the HealthWell Foundation. I'm Carla, the Director of Education Initiatives at NeedyMeds. And as usual, before we kick off the presentation, I'm going to offer some tips so you can make the most out of it, such as if you do have questions throughout the presentation, we certainly encourage you to ask them at any time by typing them into the questions section. For some of you, it may actually be the chat section of that GoToWebinar control panel on your desktop. And if that control panel is in your way, you can drag it to the corner of your screen. Just don't close out of it or you'll log yourself out of today's presentation. We do our best to answer questions at the end of the presentation, but we do keep that question segment brief. If we don't get the chance to answer your particular question, we will be in touch with you as soon as we can via email, but of course, we will also provide our contact information at the end. The heads up that this webinar, like all of our other webinars, videos, and presentations, will be converted into a video and uploaded to the NeedyMeds YouTube channel, which I do hope you subscribe to. And as you saw on the first slide, hopefully, we did upload some handouts we thought you'd be interested in into that handout section of your GoToWebinar control panel, so check that out as well. So let's get started really quickly with what is NeedyMeds. For those of you not yet familiar with us, we are a national nonprofit, and that's all of our fancy wording for our mission statement on our screen. But simply put, NeedyMeds connects people to healthcare savings and education programs, free and anonymously, through our website, needymeds.org, and our helpline, 1-800-503-6897. And I wanted to stress that free and anonymously part. I think in light of news items that are peppered throughout our lives, we often learn that other healthcare savings resource options out there, although they are free, your data is being collected. It is not anonymous. So we're proud to let you know that anytime you reach out to NeedyMeds, whether it's through our website or helpline, you can remain anonymous. We do not collect personal data. Your confidentiality is guaranteed, so you can be assured that we can't share or sell your information. Hopefully that puts your minds at ease. So again, reach out to us at that website, needymeds.org, or our toll-free helpline, which again, that number is 1-800-503-6897. Our expert call center counselors are available weekdays from 9 a.m. to 5 p.m. Keep in mind that is Eastern time because we are located in Massachusetts. Also, I'm happy to let you know we do have Spanish-speaking counselors. Now, if you do visit needymeds.org, we are so proud of the breadth and scope of the resources we have, so I encourage you to peruse it when time allows. For now, I'm just going to take a moment to showcase a screenshot of the homepage, needymeds.org, which is what you're looking at now, and point out just a few resources, such as if you are turning to NeedyMeds for healthcare savings, click on that Healthcare Savings tab. I also encourage you, when time allows, to check out that Education tab next to it. That is chock full of other resources we think you'd be interested in. You can sign up for other upcoming webinars. You can sign up for a monthly newsletter, Vitals. You can click on to our educational website, Be MedWise, which we're super proud of. You can order brochures and on and on. So check that out when time allows. I'll also point out, because I mentioned that today's presentation is being recorded and will be uploaded to our YouTube channel, that you can find a link to that on the top right-hand side with the rest of the social media icons. I also met under that Education tab, one of the many resources you can find is upcoming webinars. Well, you can also find upcoming webinars on the calendar of events on the bottom right hand of our homepage. So again, check those out. Now, as I said a little bit ago, and you saw on my screen, a big part of the Needy Meds mission is educating people. And as you would imagine, we define that, of course, by educating people about Needy Meds and the healthcare savings and education resources we offer. Excuse me a moment, but we also fulfill and define that part of our mission by educating people about other savings resources and expert tips from other partners, which is why we are so pleased to have my friend and colleague, Audrey Cordy from HealthWell Foundation here with us today. And what you're looking at is their website. As you can see, I find it, and I think you'll agree just from this quick screenshot of their website, it is clear what their mission is about, and it's really easy to navigate it. So again, check that out when time allows, because today we are lucky to have Audrey, again, my friend and colleague, talk about the HealthWell Foundation and how it can help you, your loved ones, your patients, and clients. And before I pass the mic and the screen over to her, I just want to make sure that everybody knows what the HealthWell Foundation is. They are a leading nonprofit dedicated to improving access to care for America's underinsured. And I do feel like that the population of people under that umbrella of underinsured just keeps growing and growing. Anyway, the HealthWell Foundation's mission is to reduce financial barriers to care for underinsured patients with chronic or life-altering diseases. So basically, when health insurance is not enough, they fill the gap by assisting with copays, premiums, deductibles, and out-of-pocket expenses. Now, let me tell you a little bit about my friend and colleague, Audrey, who's going to walk us through what the HealthWell Foundation is all about and how you can reach out to them and get the help you need. So Miss Audrey Cordy joined the HealthWell Foundation just recently in 2022 as an Associate Director of External Relations. In this role, she serves as a liaison to physician offices and pharmacies to ensure familiarity with HealthWell's programs and processes and strengthen HealthWell's alliance development activities with medical specialty societies. Audrey is also responsible for strategically advising HealthWell's corporate management, external relations, and development teams on the most efficient methods and procedures to increase stakeholder engagement on behalf of the patients. She does a ton. She coordinates activities with external relations, development, and operations teams to create performance metrics to maintain and increase stakeholder satisfaction. She has over 12 years of experience in the healthcare industry, focusing on health insurance coverage, reimbursement, and very importantly, access to care programs. Before joining HealthWell, she served for over 6 years at another leading foundation where she managed healthcare provider and pharmacy relations, again, ensuring all stakeholders knew about the programs and processes. And I'm happy to pass the mic and the screen to Audrey, and you're going to see why we are so proud of our relationship with her and also the HealthWell Foundation. So I say this all the time. I'm going to try and do this seamlessly. So bear with me while I go ahead and transfer the screen to my friend. So bear with me. And as I do that, let's just make sure, there we go. And hopefully Audrey can grab that screen. And as I transfer that screen over and Audrey shares, perfect, wow, that was lightning fast, shares her PowerPoint presentation. Before I pass the mic, I will remind everybody that we encourage questions. So if you do have them, don't hesitate to type them in to that questions or chat section of your GoToWebinar control panel, and we'll do our best to get to them at the end of the presentation. With that, I'll pass the mic to Audrey. Enjoy the presentation, everyone, and thanks for being here.
Thank you, Carla, for that nice introduction. And hi, everyone. Thank you so much for joining me today to learn more about the HealthWell Foundation and how you can easily apply for financial assistance for your medication copays or health insurance premiums. So my name is Audrey. I'm the Associate Director of External Relations at the HealthWell Foundation. And as Carla said, this webinar will be recorded and shared with the participants. And if you have questions during the webinar, as Carla said, please share them in the chat box. I will try my best to answer them at the end, but if I don't get a chance to answer them all, I will respond via email. And also my contact information will be shared at the end of the presentation. So before we get started, let me share the roadmap. Today, we will learn about the HealthWell Foundation and review our programs and learn how to apply for assistance in minutes, and then also file a claim to receive reimbursement. And then finally, I will also share some helpful tips for navigating our portals and tools to maximize your search for patient assistance at HealthWell. Okay, let's go ahead and get started. So the HealthWell Foundation is an independent 501c3 national nonprofit organization that is located in Germantown, Maryland. HealthWell was established in 2003 to improve patient access to life-changing medical treatments. To date, we have awarded over 1.3 million grants and paid over $3 billion to more than 822,000 patients. In 2022 alone, we provided financial assistance to more than 169,000 patients and awarded over $890 million in grants. Also, it is important to note that 100% of every donor dollar we receive goes directly to the patient's grants and services. In 2021, West Health conducted a poll about healthcare in America and reported that 30% of Americans are concerned about being unable to pay for their prescription drugs. When health insurance is not enough, HealthWell fills the gap by assisting with the patient out-of-pocket cost, including prescription drug copays, coinsurance, and deductibles for prescribed treatments. We also assist by paying the health insurance premiums for the primary or secondary insurance of the patient and other costs related to vitamins and supplements, pediatric assistance, travel, and behavioral health services. Some disease funds are Medicare access only, meaning that the patient must have Medicare insurance to qualify, while other funds require that the patient have any form of insurance. So HealthWell has a wide range of disease fund categories, starting from autoimmune diseases to urological disorders. Overall, we assist with more than 85 disease funds, including 30 in oncology. Just last year, we newly launched or reopened 16 disease funds and continue to grow. Under our disease funds, HealthWell pays the out-of-pocket costs for all FDA-approved medications or compendia listed for the disease state. So this includes prescription medications on our list of covered treatments, including generic, brand, and biosimilar medicines for the treatment of the disease, or the insurance premium for both private and government health insurance, such as Medicare or Medicaid. HealthWell will pay the health insurance premiums to the insurance company directly, or the patient may pay upfront and get reimbursed. Then finally, we also assist with other specialty funds, which we'll discuss in the next slide. So the specialty funds at HealthWell allow us to have a diversified portfolio to assist more patients in underserved disease areas. For instance, we created a behavioral health services fund for cancer patients and emergency medical workers. The funds assist with the out-of-pocket cost for prescriptions, counseling services, psychotherapy, and transportation. The HealthWell Pediatric Assistance Fund was also set up to support a wide range of disease states affecting children. Since its launch, we have helped children in almost 400 unique diagnosis areas. The fund helps with the cost share for prescription drugs, biological therapies, devices, surgical procedures, counseling, and other treatment cost shares related to various diseases or conditions. Please note that this fund accepts phone applications only. We also have the Vitamins and Supplements Fund for cystic fibrosis and Alagille syndrome to support the specific nutritional needs of patients in these disease states. In addition, we were the first among the copay foundations to set up a COVID-19 ancillary and premium payment assistance fund in response to the need during the pandemic. And finally, we have the Gout Travel Assistance Fund to help with the travel costs related to obtaining treatment for gout. Now, this fund helps with the financial barriers of getting to and from appointments. And partnering with Ride Health has helped patients to access assistance without having to come out of pocket. And if the patient prefers, they can pay upfront and get reimbursed. So now that we have learned a little more about our assistance programs, let me show you how to apply for assistance at HealthWell. So before applying, we need to gather, I would ask that you gather the following information: the patient's demographic information, such as the legal name, date of birth, address, and etc. Now, if the patient is 18 years of age or under, we require the parent or guardian information. You also need the health insurance and healthcare provider information, as well as a household income, household size, and social security number. And for those who do not have a social security number, we will accept a tax ID. Please note that you only need the income information for our online application on our website, which we'll go over a little bit later. And then finally, you will need the disease fund and the medication you're taking for treatment. Step 1. So after you've gathered all the required information, take a moment to review our general eligibility guidelines. Applications must have the following. Some applicants, must have the following: some form of health insurance coverage for the product through either major medical or prescription drug insurance. Funds that are Medicare access only require Medicare insurance to apply. The household income must also fall at or below the federal poverty level or FPL guidelines of either 400 or 500%. Check under the household income limit on the disease fund page to determine the FPL, as this requirement varies by fund. New on our website, and it's something we're very excited about, is the FPL calculator link from our friends at NeedyMeds to help you calculate your FPL level. Or if you prefer, we also have a PDF version under Web Tools on the main page of our website. HealthWell disease funds are also diagnosis-based, so another requirement is that the patient must be getting treatment for the disease fund they wish to apply. For instance, if you're applying for the hyperoxaluria disease fund, you must be treated for hyperoxaluria, and the medication or product you're taking must also be on the list of covered treatments. Finally, you must also be a permanent resident and receive treatment in the United States or US territories. So now that you know the general eligibility guidelines, let's review where you can find the specific requirements and other important information on the disease fund page. So we will use our Cystic Fibrosis Disease Fund page on our website as an example. First, let's review the status of the fund and ensure the disease fund we are enrolling in is open and accepting enrollment or re-enrollment applications. Second, let's verify the FPL level under the household income limit and check the list of covered treatments to ensure the medication you're taking is an approved product on the list. Then review the qualifications. Step 2. So after you've gathered all the necessary documents and determined eligibility, it is time to apply for assistance. There are 3 ways to do this. First, you can apply through our website at www.healthwellfoundation.org. Second, you can apply through our portals. We have the provider and pharmacy portal for the healthcare staff and the patient portal for the patient, caregiver, or power of attorney. We also created a user-friendly patient portal to empower our patients and allow them to manage their grants. And then lastly, you can call us at 800-675-8416, Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. On our website, there are several ways to apply, as you can see here on our slide. First, you can apply through the Disease Fund page. Second, you may also apply through our portals. Third, you can click on the Apply and Re-enroll button on the homepage to start the application, or you can call us to apply. So let's start an application through a specific disease fund page on our website. We will start by navigating from the disease fund page to the specific disease fund page we want to apply. Please ensure that the fund you select is open. Let's go ahead and select the Hep C fund. And once you choose an open disease fund, scroll to the bottom where it says, "Do I qualify?" and click Apply/Re-enroll to begin the application. So after you click Enroll from the disease fund page, you will land on the application's main page. We are excited to offer the ability to complete your entire application in either English or Spanish. Please take a few moments to review our online application instructions along with our privacy policy before you click Continue. We ask that you submit your online application once to ensure our grant approval process is completed timely. Also, we have made our portals easy and accessible to our providers and pharmacies, and we want them to use our portals to enroll patients so that they can manage the grants better. If you are a provider and pharmacy and you're on this call today and would like a demonstration of our portals, I will share my contact information at the end of the presentation. Next, select if you are the patient and you are 18 or above, or a caregiver or guardian, in completing the application for a family member and click Continue. We will ask you to answer a few short questions to determine your eligibility. First, we want to know what disease fund you want to apply for. Please review the list of funds and select the disease fund you wish to apply. In this instance, we pre-selected the Hep C disease fund. Make sure it is a correct fund you want to enroll in, then select all the medications you're taking for the disease state. Then confirm that you have insurance for the therapy and select Continue. Please note that we encourage you to apply on the patient portal so that you can easily manage your grant. If, however, you choose to apply online, you can still obtain a patient portal with your HealthWell ID number. Next, you will be required to select the type of assistance you need. So HealthWell allows applicants to either use their grants for prescription drug copay or health insurance premium assistance. If you choose copay assistance, HealthWell will assist with the out-of-pocket cost of your treatment. Check the fund page for specifics. We will help you with your monthly health insurance premiums if you choose premium assistance. Once you have made your selection, click the Continue button. Then take a few moments to review the patient attestation, which confirms that the information you provided is true and accurate to the best of your knowledge, and then check the box to indicate that you have read, fully understand, and agree to the patient attestation. Once you have checked the box, click Continue. Next, we will need your state, household size, and then household income to determine your eligibility. Please note, we only need the household income and size for the online application. Once we obtain this information, we will verify your income internally. If we are unable to verify the information, we may require income verification documents. If this happens, you may upload your income information and other supporting documents on the portal, or by calling us, or by faxing it to 800-282-7692. Make sure you complete all the required fields and click Continue. Please note that please complete the form with the patient's name, phone number, and mailing address, then click Continue when you finish. At times, we may require additional information for the patient's grant. Therefore, it is extremely helpful if HealthWell has the name and contact information of the patient's prescribing physician, especially if we need to verify the patient's diagnosis. So please enter your provider's information along with your insurance information and click Continue. Then take a few moments to review your application. You may edit the information you provided if necessary. If all your information is correct, please click Submit. And congratulations, you completed our online application. Once you submit the online application, we will review and complete the process and follow up with an approval letter. You may call or check the application status using our online web tool on the main page of our website. Determination is made within 24 to 48 hours. For all other application methods, such as via phone or one of our self-service portals, either patient, provider, or pharmacies, our application approval is instant. Once approved, we offer the following: instant notification of approval, access to start using your pharmacy card, direct billing with providers, pharmacies, and patients, and the approval is for 1 year with eligibility to re-enroll after 12 months. We operate on a rolling calendar year, which means we open the disease fund when we receive funding. Therefore, you may start reapplying 30 days before your enrollment end date if the disease fund is open. In addition to instant access, there are other things about the grants that you should know. So we offer a 30-day look-back period for each grant to allow the submission of claims with the date of service within the last 30 days. So whenever you apply, your grant start date will be 30 days before the date you applied. We also allow up to 120 days to submit claims after the grant end date. Certain funds may offer additional funding or grant replenishment if funds exhaust during the 12 months eligibility period if funding is available. An example of these type of fund, also called replenishable funds, include ALS, Dupuytren's disease, and gout. So now that the grant is approved, you may want to submit a claim. Well, let me quickly show you how to submit a claim for payment. It's important to also note that the majority of our funds offer a pharmacy card so that our patients don't have to come out of or pay out of pocket. For any pharmacy staff on this call, you can use the portal to obtain the pharmacy card information, or you may also visit our website to use the pharmacy card lookup tool. You will need the patient's HealthWell ID number. Please note that for POS claims, you will need the following claims processing information, such as member ID, also called the pharmacy card, RX BIN number, the PCN, and the RX group number. For patients and healthcare providers, you will need to gather the following information to submit a paper claim to HealthWell. If you're a patient, you will need a combination of the following: our reimbursement request form and one of the following: an explanation of benefits, proof of payment, pharmacy receipt, or invoice for us to reimburse your out-of-pocket cost. If you are a provider or pharmacy, you will need a combination of one of the following to submit a paper claim: our reimbursement request form, CMS 1500, UBO4, or for the pharmacies, a universal claim form, and an explanation of benefits, pharmacy receipt or transaction screenshot, or pharmacy invoice for us to reimburse you directly. Remember that you can obtain the patient's HealthWell ID on the approval letter and other claims processing information in the portals. A copy of the letter and the pharmacy card is also mailed to the patient when the application is approved and available to the provider or pharmacy upon request. Once you gather all the required documents, simply submit your claims in one of the following ways. You may do this through the patient, provider, or pharmacy portal. There, you can upload your claim form along with your supporting documents in the patient's grant. Next, you may fax your claims to 800-282-7692 or mail them to HealthWell Foundation, P.O. Box 489, Buckystown, Maryland 21717. So now that we have reviewed the online application process and learned how to submit claims, let's learn about tools and tips to help you manage your grant. So we are excited to offer an enhanced portal to our providers, patients, and pharmacies that feature new navigational tools to manage all patients in one account. You can also enroll and re-enroll patients, as well as upload all documents and receive program updates, which I will share a bit more on our next slide. You can also submit feedback via the message center and subscribe to real-time fund alerts. We encourage our providers and pharmacies to sign up for a portal account to allow them to apply on behalf of a patient, check the status of payments, as well as the status of grants, and access pharmacy card information. In addition, the new enhanced portals also have a portal alert feature where news about HealthWell and our portals are shared to help you stay connected. We also have the Portal Message Center, which is another tool where we share our program updates and tips that can help you easily manage your grants, as well as the ability to send us a request about your patient's grant through the Portal Message Center. Coming soon, you can complete the reimbursement request form right in our portals. HealthWell provides many tools to making navigating our programs easy. Our real-time fund alerts provide instant notifications to allow users to track the status of HealthWell's diverse portfolio of disease funds in real time. So you can access the link and the other tools on our landing page. Simply select the fund you are interested in to monitor to receive instant email notification when the status of the fund changes. Aside from the real-time fund alerts and the portals, we also have other tools to help you navigate your grant. You may use our pharmacy lookup tool on our website to access your pharmacy card information without having to log into our portals. And you can also check the status of your online application on the website. Coming soon, we have heard your feedback over the years, and we have heard, or we have shared you have shared with us you have shared with us your feedback over the years, and we have heard you and provided a way to access our real-time fund alert on your phone without having to log into the portal. This new tool will help you track the status of funds in real time via text message. Please be on the lookout for the announcement within a couple of weeks. So I hope the information I shared with you today was helpful and that you learned more about the HealthWell Foundation. Thank you so much, Carla, for allowing me to share the programs we offer with our audience today. As you seek financial assistance for medication copays and insurance premiums, consider the HealthWell Foundation. If you would like to learn more about HealthWell or our portals, you can reach me at audrey.corte@healthwellfoundation.org. And don't forget to follow us on social media. And now I'll turn it back over to Carla. Thank you.
Audrey, thank you so much for that detailed, enthusiastic, and thorough explanation, not only about what the HealthWell Foundation is, what you are all missioned to do, but really importantly, how you walked everybody through how to actually take the steps to get the help they need. And I'm always so pleased to introduce people to the HealthWell Foundation and welcome you and any team members to share the resources you guys offer with the Needy Meds audience. It's our pleasure, and I can tell for today's presentation people were clearly interested in learning more about the HealthWell Foundation, and from the participation from attendees, really also enthusiastic about the resources you shared. So we got a lot of feedback coming in, and as everybody knows, we do keep the question segment brief for these live webinars. However, if you did ask a question, we will get the chance to answer it at the end. As Audrey said, we will follow up with you via email, but I will once again put the contact information for both the HealthWell Foundation and Needy Meds at the end of the presentation. Before I get to all those questions coming in for Audrey, which was a great presentation again, thanks so much, Audrey, I want to remind everybody that Needy Meds is also here as a source of support if you're having trouble affording healthcare expenses. And that includes, but is not limited to, medications. And what you're looking at on your screen right now are the categories of ways you can save on your healthcare saving expenses, which can be found under the Healthcare Savings tab, again, on needymeds.org. If you don't always have access to the internet or would rather speak with a live person, in addition or instead of visiting needymeds.org, certainly don't hesitate to reach out to our expert call center counselors at 1-800-503-6897. I mentioned on our homepage under that education tab or the calendar of events on the bottom right-hand side of needymeds.org, you can find upcoming webinars. The reason I'm bringing that up is because we do our best to populate that calendar with other resources and partnering nonprofits that can help you, your patients, your clients, or your loved one in your healthcare journey. And we also populate that calendar with webinars about Needy Meds. About monthly, we host overview webinars to patients and providers. And we also do very quick webinars, literally between 10 and 20 minutes, doing a deep dive into specific healthcare savings resources. So check out that calendar of events for upcoming webinars. There may be some you're interested in. I hope there are. So as I can see, many of you remember that if you do have questions for Audrey or me regarding Needy Meds, you can type them into the questions section. For some of you, it may be the chat section of that GoToWebinar control panel. And as we get to those questions coming in, I wanted to leave up the contact information for both the HealthWell Foundation, which is the healthwellfoundation.org. Their toll-free helpline is 1-800-675-8416. And of course, Audrey, give me a shout out if I have that incorrect. Otherwise, we'll go ahead and get to those questions coming in. Thanks, everybody. So Audrey, one of the questions that came in, and although this is specific to one of our attendees, I think it's important to answer it during this presentation because I bet it's a situation that others find themselves in, and it will shed a lot of light on a situation that our webinar attendees may find useful. So here's what came in. The attendee shared that her daughter has a rare genetic disorder, and she can't seem to find any program that provides copay assistance. She wants to know, can I apply for pediatric assistance? I think that's a great question.
Yeah, that is a great question. And actually, before I start, Carla, yes, the information you have up is correct.
Perfect.
And it's an excellent question, and thank you for asking it. Yes, as long as her daughter is 18 years of age, then they can definitely apply for the Pediatric Assistance Fund. Just please note that this application process for the pediatric fund is a little different than the other application processes that we have, that it requires that you do a phone application. So in addition to that, we also require that the patient's guardian, the patient's parent or guardian sign a brief letter. In addition to that, also providing the patient's health insurance card And then another requirement for this fund is also that the doctor's office must complete a diagnosis verification form. And that is a form we have internally where they can find on our main page of our website. So as long as the patient is 18 years of age and under, they can definitely apply for the Pediatric Assistance Fund, since that fund covers a wide range of diseases and not just one. And in addition to that, if they once they submit all the required information, we do an internal review and provide the determination. And if they approve, then they can use the grant for prescription drugs. And I think I talked about it earlier. They could also use it for biological therapies, devices, surgical procedures, counseling, and other treatment related to cost shares for the various diseases and conditions.
Wonderful. A great question and another very thorough answer. As you could probably all tell from Audrey's presentation, one of the reasons we're so confident sharing information about HealthWell Foundation and referring Needy Meds users there is because they really go above and beyond, not only to expand the breadth and scope of the help they provide, but they go out of their way to spend a lot of time and energy on making sure getting that help is easy and understandable. As I said in Audrey's bio when I introduced her, she has a lot of expertise in eliminating barriers to patient care. And that's kind of what we're talking about when we refer people to HealthWell Foundation, that it's about as easy as it can possibly be. And as you also heard, they are very open to feedback. So stay in touch with them in any way that you can. Thanks so much, Audrey. And I love when our audience participates because I always feel like if one person has a question, probably another, at least one other person has it, and it will give our presenter an opportunity to highlight an important point or share something that hasn't been addressed. So we love the participation. So thanks for that. And Audrey, another question coming in, and I bet this is one you get all the time. What if my medication is not listed as a covered drug? Should I still apply if you have the fund for the disease? Love that question. Really important.
Yes, that is also a very good question. So if the medication is not covered, I would say for us at HealthWell, what we do is that we try to monitor in real time and update our list of covered treatments as we get the news of new treatments that the FDA has approved or compendia listed. So we try to stay up to date on that. I would say if you haven't already done so recently, I would check again on our medication lookup tool on our website to see if maybe the medication is covered, as long as it's for the disease state. But if you don't see it as covered, but we do have the fund and you are taking that medication for that disease state, then I will recommend that you reach out to us and to see if it's a possibility of us adding this particular drug to the fund. There's one caveat though, we cannot guarantee approval, but we can certainly review internally and determine if the product should be covered on the disease fund. But a very good question. And usually because whatever disease fund you apply to, the medication has to be on the list of covered treatments. If it's not covered, we're not going to be able to reimburse. However, if we're able to review and then find that this is something that should be covered under the fund, then of course you can apply for that fund and then be able to get reimbursed either through the pharmacy by using the pharmacy card. The pharmacy can bill us, or the provider, or the patient.
Fantastic. Thanks so much for that answer and for the participating question. We appreciate it. I'm going to actually go ahead and field a question, which I think is an important one. One of the attendees asked, what does HealthWell Foundation do that Needy Meds doesn't? And that's a great question. So the way I would explain it is that the HealthWell Foundation offers direct assistance, whereas Needy Meds, you can think of us as sort of an old school way of explaining it as the yellow pages of healthcare savings options. Needy Meds does not provide direct assistance. What we do instead is refer people to programs or resources that will help them to do so? That's a great question. And we often find ourselves making that distinction. So thank you so much for giving me the opportunity to drive home that point. I appreciate it. Audrey, another question coming in. I'm going to go ahead and direct this one clearly to you. This user is indicating, or participant is indicating, I was going to apply for a fund and saw it had closed. What would you recommend? And it's interesting because I also had a question about closed funds. This participant asked, if a fund is closed, can we still apply so that we're on a waiting list? So if you can go ahead and speak a little bit about closed funds and how to navigate that.
Sure, that's also a good question. And I would answer maybe the second question first regarding a waiting list. So we don't have a wait list at HealthWell. It's all first come, first serve. So once we open the disease fund and once we receive funding and open that disease fund, then if you apply, then we just go ahead and provide the assistance as funding is available. With that said, I would say if the fund close and funds do open and close quickly sometimes, and so one way to keep track of that is to be able to use the real-time fund alert. It's really helpful because you're able to see everything in real time, especially on our website. Everything is real time. So once we open it, you will get that notification to let you know that this fund is open so that you can go ahead and apply quickly before it closes. For some of the disease fund, it can close literally within an hour, or some too are able to stay up longer. But for those that may go quickly, they can go ahead and apply. So I would say definitely the real-time fund alert would be a great tool to use on our website. And then in addition to that, what I was explaining, what I shared earlier, is that the real-time fund alert is also going to have an option to now receive text message notification, which is excellent because the participant that asked this question could definitely sign up to receive this text message notification, which would be easier because they can just get the notification on their phone. I know not everyone is always checking email, but you usually have your phone with you. So hopefully they can check their phone when they get that text message and be able to apply quickly before the fund closes. So I would say they should probably expect that that real-time fund alert, the option to receive text message somewhere between early to mid-March.
Wonderful, Audrey. And thank you so much for sharing and stressing the importance of the real time fund alert. I was blown away when the HealthWell Foundation launched that, and I think it's incredible they transitioned to being able to notify people via text. As you said, we do our best to check our emails, but certainly a notification right to a text message to your phone certainly gets you in the know a lot more quickly. And just to clarify, Audrey, do people need to register for the portal to use the real-time fund alert? That's one of the questions we're getting in.
Oh, thank you. So for the real-time fund alert, right now, there's two options. So they can go into their portal. So in the provider and pharmacy and patient portal, they can sign up for the real-time fund alert directly in the portal. They can also separately sign up to receive the email message. So it doesn't necessarily have to be that portal, but they can go on the real-time fund alert portal and sign up there. Or the new option to receive the text, they don't even have to log into a portal. They can just sign up, and once they sign up, they will just get the notification via text once they select whatever disease fund they want to follow.
So simple. And that's another example of just removing not only access to care, but access to barriers that would keep people not up to date and alert of what they may be eligible for or can help them.
Exactly.
One other question coming in, it's really important, Audrey. One other question that is coming in is, and I think I know the answer to this, but I want to give you the opportunity to address it, which is, what if there's a disease that somebody's interested in that's not actually on any of the lists? Is there a way for a patient to request that a disease be added? How do they give feedback? Can you speak a little bit about that?
That's also a really great question. So on our website, we do have a list of funds in development that they can look at, because there are times when we may already have that already as one of the disease funds that we're hoping to be able to develop and have as a disease fund at HealthWell. But otherwise, they can also reach out and share that information. But there's definitely an opportunity for them to be able to give that feedback to us. In addition to that, also on the portals, they do have the message center where they can share their feedback with us. So that's something that they're interested in. They could send it to us, and we can forward it to the right department at HealthWell, and they can review that and add it maybe to the list of disease funds in development, or disease funds that we're thinking about possibly putting up as a fund at HealthWell.
Perfect. Thanks so much. And as I showed in the beginning of my PowerPoint slide deck, I had a screenshot of healthwellfoundation.org. I encourage everybody that's attending and to spread the word and negotiate, navigate, play around on that website, because you're going to very pleasantly find that it is intuitive. It's easy to find what you need. The HealthWell team has gone above and beyond and continues to improve their website and the way they communicate that with those that rely on them, to make sure it's intuitive, it's easy. So check it out. You'll be very pleasantly surprised, and you'll find ways to, importantly, stay in touch with them. So I want to wrap it up with just one more question that I found really interesting. And Audrey, this question is, somebody is sharing that they don't file taxes because they're on Social Security. Does this person, or anybody really, need to know their income before they apply to a grant? Great question.
So yes, and I think if you're applying online, meaning the website, on our website, the way that I showed you on this presentation, then you will need to have the income information to apply. However, if you apply in one of our portals, or if you call us to apply, then you will not need to provide any income information. What we'll do is that we'll verify the household income through a third-party service. And if we are unable to verify it, then we will request income documentation. And yes, they'll be able to just submit their Social Security information. If that's all they have, they can submit that to us. And one of the great tools is that if they have a portal account, they could upload that information right on the portal, or they could also fax it, or they can mail it to HealthWell. But there are just different ways to do it in case that they have to submit this information. But if they don't have it and they prefer to just maybe call us or go online, they won't need that income information at all.
Wonderful. I thought that was a really interesting question, and I'm sure it applies to a lot of people reaching out to the HealthWell Foundation. So as I said, we do try and keep the question segment relatively brief, and I'll reiterate that if you reached out and we didn't answer your specific question, you will hear back from myself if it's related to Needy Meds, or Audrey and another member of the HealthWell Foundation team as soon as we can. Of course, if you need an immediate answer, don't hesitate to reach out to healthwellfoundation.org or call one of their experts at 1-800-675-8416. And of course, the direct contact information for Needy Meds is needymeds.org, and our toll-free helpline is 1-800-503-6897. With that, a big thank you to my friend and colleague Audrey for taking time out of her day to share her expertise about the HealthWell Foundation with Needy Meds users. And a big thank you to Needy Meds users and friends for taking time out of their day to learn a little bit more about Needy Meds and the partnership that we are so proud of with the HealthWell Foundation. Thanks so much, everyone. Check out what we uploaded in that handout section, and please remember to stay in touch with the HealthWell Foundation on their website, follow them on social media, and do the same for Needy Meds. We hope to see your names pop up in future presentations and webinars. Thanks, everyone, and have a happy, healthy, and enjoyable rest of the week. Take good care. Bye.
Thank you, Carla, for having us.